Josh, good to see you again. How are you doing today?
Yeah, not so good.
Well, I'm sorry to hear that. What brings you in today?
Well, I'm getting frustrated because I can't get my prescription without coming in to be seen, and you've known me for 10 years.
Are you referring to the hydrocodone for your back pain?
Yes, I've been waiting for a new prescription for 2 days. I don't understand why I have to come in for reevaluation.
Well, the reason is that it's a controlled substance and can be addictive.
So?
Well, you've been calling in and requesting me to send new prescriptions early.
What are you trying to say?
I think we should talk about how addictive hydrocodone can be. Can we discuss this?
If you think it necessary, but I'm not addicted.
I do think it's necessary to discuss this with you because of the increasing amounts and the use of this medicine.
What do you mean?
Well, because you travel with your job as a sales rep, you have mentioned in the past that you've seen doctors in different locations.
Right. Sometimes when I need to see a doctor, I'm on the road, so it makes sense to have options for my prescription if needed.
Well, providers have access to an online controlled substance reporting system that shows where you've received hydrocodone and oxycodone combinations in different locations.
Yes, but that was because I left my prescription at home one time, then my luggage got lost when I went to another location. I cannot be without these medications. My back and my neck hurt so badly from my herniated disc.
Your prescription states that you're to take 1 to 2 tablets of oxycodone as needed every 6 hours. Are you taking this medicine as prescribed?
1 to 2 tablets every 6 hours stopped working for me a long time ago. The pain never went away after taking the medications, and I started taking 2 hydrocodone every 3 to 4 hours.
So you're taking about 12 or more pills in a day, is that right?
Yes, I suppose that adds up.
How do you feel when you take the medication as prescribed every 6 hours?
I feel terrible. My back and my neck hurt because my head starts to pound. Then I get sick from a migraine. All these symptoms make it next to impossible for me to do my job because I get so irritable and my stomach hurts.
Have you ever considered that your headaches and the nausea are coming from withdrawal of the hydrocodone?
No, I believe all these symptoms are coming from the pain I feel in my back and my neck. That's why I need the new prescription for the hydrocodone, or oxycodone if you prefer.
How would you feel about taking a different pain medication for your back and neck pain, and we slowly wean you off the hydrocodone?
Yeah, I don't want to try a different medication. I know my regimen works. I even tried your physical therapy you ordered, and it didn't help at all.
I'm concerned with the amount of narcotic medications that you're taking in a day. Also, you're going to multiple providers for other pain meds. This indicates misuse and it violates the pain contract you signed.
I know I take more hydrocodone than you prescribed, but without it, I cannot make it through my work schedule. It's just not possible.
The way you're taking medications is risky with all the driving that you do, and this places others in danger. You're also putting yourself at high risk for overdose. You also told me in the past that you drink alcohol socially on the weekends.
Yeah, I know you're the doctor, but I don't think overdose is a problem for me at 26 years old. Besides my chronic pain, I'm in great shape. I know my body can handle the medication, and I've never had an issue while driving or getting sleepy. As for the alcohol, it's only on the weekends and occasionally during the week if I can't wind down.
I can understand that you're extremely frustrated about needing to come in today for assessment.
Well, of course I'm frustrated. I'm in pain and I can't get treatment.
It's concerning to me that you're seeing different doctors to get pain medications and how often you're getting similar opioid pain medications. It's clear that no one has been helping you manage this problem safely.
I know I take more than is prescribed, which causes me to ask for a new prescription. However, I don't think I'm misusing it because it helps. I'm a respected professional using it to manage my pain so I can work.
I believe that you're a hardworking person who travels and has been doing whatever is necessary to function. But I think we need to try another medications besides an opioid to help with your pain.
I really don't want to start all over with all the different pain meds we've tried in the past and didn't work. Nothing else helps my pain like the oxycodone or hydrocodone.
I understand that you're in pain and it's chronic. I want to help you. In order for me to keep taking care of you, we must try a different treatment.
But I have to travel and work.
I know, but we have to look at other ways to handle your pain. I suggest a medication-assisted treatment program that can start you on a medication which has similar opioid action. It allows you to come off the oxycodone and hydrocodone, and it also provides counseling that's necessary for your long-term success.
The only way I will consider this treatment is if it takes care of my pain. I'm not addicted like a person buying it on the street.
Well, I think you are dependent and addicted to the hydrocodone we've been prescribing, and we have to address that today for me to take care of you. Would you consider being referred to a pain treatment clinic that's available locally?
If you're going to insist, then out of respect, I'll listen to what you have to say.
Okay. We have an opioid alternative using an anti-inflammatory that will treat your pain, and I'll make a referral to the pain clinic today. The other important referral is to our Suboxone clinic. And as I mentioned, the program is combined with counseling to help you get off the other opioid drugs.
Okay, I've heard of Suboxone. I'll go to the pain clinic first, and I'll think about the Suboxone clinic.
You'll also have to make a formal commitment to stop requesting pain medicines from outside clinics. The pain clinic and Suboxone clinic would work together for your treatment. There will also need to be a discussion of options for your herniated disc.
Well, maybe it is time to consider surgery that we discussed a year ago.
I agree. So let's make a plan to do what we discussed. I'm glad we have a start on this process. I will step out of the room now to gather appointments and the necessary information for your follow-up.
This case exemplifies a patient who's very frustrated. He's in denial that he has an opioid problem, and as primary care providers, we're often encountering patients like this who are escalating their pain medication use and getting pain medication from multiple providers. This patient is challenging, of course, and has evidence of real pain, but because of what he is doing in terms of seeking his medication, he's broken his pain contract. The strengths of this encounter include the fact that the provider discussed the frequency of the patient's opioid use and the possible consequences that it could cause. The provider also did a good job eliciting the patient's response, regardless of how oppositional the patient was in acknowledging his addiction. The provider could have done more rapport building. That's a weakness of this encounter. The provider also didn't give much time for the patient to reflect or for the provider to reflect back to the patient what the patient had just said. And the patient's ideas of pros and cons of opioid use were not fully discussed in this encounter. Things were also admitted, of course. The provider didn't use the DAST-10 questionnaire. Now, in clinic, when we're rushed, we sometimes don't have time to administer a questionnaire like that. However, when you're dealing with a patient, particularly a patient has denial, having something quantitative can really help you break through some of that denial. Both the readiness to change and the DAST could have been used to show the patient that he does have opioid misuse. There were missed opportunities as well. The provider did not acknowledge the patient desire to avoid being called a street addict. It would have been good to talk about that and explore the patient's resistance to that kind of label. And the patient said, "I'm not like a person buying it on the street," and that really uncovers to the provider the patient's fears about addiction. The provider could have emphasized that he agrees with the patient that he's not a street addict, but can go on then and to discuss the patient has an opioid misuse disorder.